Hi, this is Dr. Mahadevan, and we're going to do our abdominal pain discussion case, part 1. And let's start and meet Travis. Travis is a 35-year-old, and he comes in with abdominal pain. And he's had this abdominal pain about 6 hours, and it's increasing in intensity. He's had one episode of vomiting, no diarrhea, and he comes to the emergency department because it's just not getting better.
Yeah, I was in a lot of pain on the drive over, but I feel okay now. Figured they'd assign me another nurse.
Just doing my job.
So things are going pretty well, huh?
Your temp's 99.4. Your BP is 124/80. One of the docs will be in to check you out.
So his temp's not that high and his blood pressure's okay. He's got abdominal pain. So what are some other questions that you would ask a patient who's got abdominal pain? And does he have any what we call red flags on his history? Was there something that he said in his history that made you concerned about a serious condition or a surgical condition? And then finally, what are the diagnoses that you're worried about in his differential diagnosis? So what are the things that we should be worried about in a patient with abdominal pain?
Steve Curtis, 35-year-old detainee with abdominal pain, rule out IP.
Oh, we got a detainee.
That pain was 10 out of 10, now it's resolved.
Resolved, that's convenient. Oh, Mr. Curtis, I'm Dr. Clemente. Are you feeling any tenderness at all anywhere?
No, it's better now.
His right count's 10,000.
Well, that's not very impressive at all now, is it?
Pulse is down after a liter.
It was pretty painful for a while.
Yeah? Could be the stomach flu, though, right? I mean, you live in close quarters. That kind of thing can run rampant to half the population.
So the doctor has made a diagnosis, stomach flu. So what do you think of that diagnosis, stomach flu? Is that appropriate for this patient? And then in terms of the physical exam, what are the physical exam findings that you would expect in a patient with appendicitis? And are there any special diagnostic tests or physical exam tests that we can do in patients with appendicitis to try to identify that particular diagnosis?
Anyway, well, you're feeling better, right? And Dr. Rescotra here will sign you out.
He has a low-grade fever. Maybe we should observe him for a bit.
Come on, it's barely a low-grade fever, please.
CBC shows a left shift.
Yeah, but there's no leukocytosis.
You want to write up his aftercare? No, read the CBC. I mean, you don't have to do that for me. I'm not doing it for you. His history tells me to do it.
So the doctors are talking about a CBC, or complete blood count. What is the utility of a CBC in someone with abdominal pain? And how about getting serial CBCs? Does that have any value? Is that useful in someone with abdominal pain? And then what are some other lab tests that we would order in a patient with abdominal pain? And then finally, they've decided to send this patient home. What would you do? Would you observe, discharge, or maybe get some other imaging studies? What would you do in this particular case?
Blood work's back on your no doubt unfairly prosecuted, wrongly incarcerated, rule out Appy.
Hey, I told you to discharge him, didn't
Well,
I?
his white count's up to 12,000.
Well, that's a big deal.
What,
So
if his appendix burst on the way here, his pain might have been temporary. We should wait, see if he declares himself.
Forget it. I already examined him. Let it go.
His temperature's up to 100.4. Well, it could be an appy. Right.
No way. This is impossible.
Let me take a look. Well, the initial exam could have been done in the post-perforation window.
Right, but then he have signs of peritonitis, wouldn't
Takes
he?
a while to develop. Steve. Hey, Steve. His diaphoretic belly has a pulse.
All right, 2 liters wide open. Put him in Trendelenburg.
Okay, can you get his cuffs off, please?
All right.
Abdomen's rigid as a board.
He can't be. He was completely soft.
Pressure's only 70 pow. He's gonna need a second IV.
All right, give him a gram of Suboxetine.
We're gonna take him to the OR. If we get his pressure up, he's septic. Mix up dopamine. Run a VTAC. Okay, get the crash cart.
So this patient's condition changed pretty dramatically. When he first came in, he was talking and carrying on and didn't look that sick, and now all of a sudden he's become very ill-appearing, diaphoretic, a very thready pulse, a low blood pressure, and the doctors are concerned. So what happened in this particular case? What do you think went wrong, and what, if you were taking care of this patient, what would you do next? What are the next steps? Would you consult any other physicians? Would you do any other testing? Would you do any other therapeutic interventions? What would you do next in this particular case?
OR3, hip bumped your lap, Coley. Hey.
We've all had cases where things don't go the way we expect, and obviously this doctor is very upset about missing the diagnosis in this patient. So what could have he done better on this particular case, and what can we learn from this particular case that would help us take care of patients in the future? Thanks very much. This has been the Abdominal Pain Discussion Case, and I'm Dr. Mahadevan.